Hello everyone, my name is Dr. Tommy Maoz. I am the Chief Medical Officer for 4 emergency rooms in the greater Houston area of Village Emergency Centers. I have a background in emergency medicine. I've been an ER doctor for 15 years and had my training in New York City and moved to Texas just about 10 years ago. I'm here to talk about the new coronavirus. The purpose of this video is really to separate fact from fiction, to give you the bottom line of what's important, what's going on, what's true, what you should look out for, what are the true indications that something serious may happen, and what isn't. No hysteria, just straightforward information. The name of this virus is 2019-NCOV, a little bit of a mouthful. So it's also been known as Wuhan virus from the city that it originated from, also Hubei province. Sometimes the virus is referred to that, the province where it's from. Let's give first the basics of the coronavirus. Coronavirus is a set of viruses that tend to happen during the winter and most often cause upper respiratory symptoms such as cold, sore throat, cough. But some of these viruses have been lethal, especially the ones that cross over from animal to human. I don't know if anyone recalls, but we had a SARS epidemic and a MERS epidemic. SARS is probably better well known. It was also from China. It started in 2019. It was also a crossover from an animal. And we'll compare some of those viruses of what they are and what this one is like to sort of see what's going to happen. Okay, let's talk about a little bit of the history of this virus. The history is it started in early December in a Chinese market of fish and meat. It initially was suppressed by the Chinese government, which has led to probably the condition that we're in today. It started to become really sort of an issue in January, where it started spreading widely throughout China. All right, let's talk about the current situation. The current situation is the data being reported is 32,000 people have been infected by the virus, and the last I checked was 638 people have died from the virus. I must note that these cases are probably way underreported. There are even people who are saying that there's 4 times as many cases as the 32,000. This is because of China suppressing some information. It's also because a lot of people have mild symptoms, not serious symptoms, and they just don't get reported, which is relevant for our later talk when we talk about mortality rate of this virus. All right. In the United States right now, we've had 12 cases, but most importantly, we've had no person-to-person infection, which is a hallmark of starting to worry about an epidemic within the United States. Okay, so let's talk about the particulars of this virus. First, we'll talk about transmission. The transmission of the virus seems to be relatively high compared to SARS and MERS, not as high as the chickenpox, probably a little higher than the flu, probably a little higher than the common cold, which makes this, moderately to high transmissible, which is a worry. The mortality rate, though, seems to be better than first indicated. It's at around 2% right now. Just so you get some baseline information, the Spanish flu was 10%, SARS was around 10%. 2% is not as much as the flu, which tends to be more 0.1%, 1 in 1,000. This is more like 2 in 100 people seem to succumb to this illness. That may drop a lot as the reporting gets better. And also, the people who tend to succumb to the illness tend to be more infirmed, elderly, immunocompromised, or very young. So the percentage for a normal healthy adult is probably quite low, but it's pretty high risk for people who maybe have diabetes, who are older, or infants, And those are the ones that probably need the most protection. Okay, other main issues that are with this virus. There's an incubation period of 2 to 14 days. This is important because how long we need to quarantine someone coming from China or some other place in the world, or how long someone who may have been sick from this virus needs to isolate themselves. So that 14-day is key. If you've been in contact with the virus after 14 days, no symptoms, no virus. All right. Treatment. Well, treatments, since it's such a new virus, it's a little hard to know what's effective. We've done supportive care, breathing treatments, and so forth and so on. But they've also done some novel treatments with HIV antivirus medication and anti-flu medications, which seem to be effective. I know they had several cases in Thailand, and the outcomes were good, but we need more data. Okay, let's talk a little bit about the symptoms of coronavirus that are going on. We kind of mentioned it already. It can go from something very mild, like a cold, almost to nothing, like almost no symptoms, to severe pneumonia. It tends to be multi-lobar pneumonia, which means a pneumonia in several lobes of the lung and both sides of the lung, all the way to acute respiratory distress and death. So that makes the condition of coronavirus very, very hard to contain because the severity of the illness is so erratic. All right. What to expect in the future? All right. So, we kind of look at history to see what happened in previous viral epidemics and what may happen this one. This one seems almost assured to be a pandemic. And a pandemic means that it's all over the world. But that has got to be put in parentheses because the pandemic, it may be a lot more severe in some countries than other countries. So countries that are neighboring China or have less resources will probably be most affected because they can't quarantine the patients, they can't treat the patients, they can't track the patients. So a place like Nepal may have or Cambodia may have a serious problem. Fortunately, the United States, I think, may be better off because we have a distance, we have resources, and we've started early. The CDC has done lots of different things to contain the virus. They are currently putting people on military bases. They're quarantining people who have had contact. So anyone who's contacted coronavirus is quarantined. Anyone who was in China is being put on a military base for that 14-day sort of window that we talked about. Okay, what should I do to prepare? What should I do to look for? Okay, so obviously basic hygiene, hand washing, stuff like that. In terms of masks, please don't hoard masks because if you do, the people who really need it can't get it. And masks work predominantly for people who are sick so they don't spread the disease. It's less effective in preventing the disease. It does have some protection, but the best way to go is that if you do have symptoms of a cold, to put on a mask. And the best mask would be N95. The next thing to look for in the United States is person-to-person infection. That means someone in the United States passes the virus to someone else in the United States. So far, we've had 0 cases of that. Even more so because we're here in Texas in the Houston area, looking for any sort of person-to-person infection here in the greater Houston area. If that is seen or that is happening, then the chances of it being an epidemic here in the United States go up dramatically. If we look at swine flu, for example, there was probably around 300,000 cases in the United States, but very, very low mortality rate. But SARS had maybe 5,000 cases, but around a 10%. So this is kind of in between the two. These things are very hard to predict. But right now, I'd have to say very low threshold to worry about. Nothing really happening in the United States. We have the wonderful resources. We are ahead of the game, but it's mainly just paying attention, right? and keeping an eye out for what's going on in your area and throughout the United States. All right, that's everything there is to know about coronavirus. Thank you for listening. Have a great day.